What is a biopsy for lymphoma diagnosis? What exactly is a biopsy for lymphoma diagnosis? This procedure is crucial in determining whether lymphoma, including non-Hodgkin lymphoma, is present in the body. A biopsy involves the removal of a small sample of tissue, most often from a lymph node, which is then examined under a microscope for cancer cells. This is the only definitive method to confirm a lymphoma diagnosis. Typically, the process starts when a healthcare provider notices swollen lymph nodes during a physical exam or through imaging tests. If there is a suspicion of lymphoma, the provider will perform a biopsy. This can involve removing the entire lymph node, known as an excisional biopsy, or just a portion of it, called an incisional biopsy. In cases where the lymph node is located deep within the body, sedation or general anesthesia may be necessary to ensure the patient is comfortable during the procedure. There are also less invasive options, such as needle biopsies. However, these might not always yield enough tissue to make a clear diagnosis or to identify the specific subtype of lymphoma. Once the tissue sample is collected, a pathologist who specializes in studying tissues will analyze it microscopically. This examination helps to identify any cancer cells and determine the specific type and characteristics of the lymphoma, which is vital for planning the right treatment. In addition to lymph node biopsies, a bone marrow biopsy may also be performed. This is done to check if the lymphoma has spread to the bone marrow. During this procedure, a thin needle is used to extract a small amount of bone marrow, usually from the hip bone, for analysis. Biopsies can also be useful after a lymphoma diagnosis. They may be conducted to assess how well the lymphoma is responding to treatment or to check for any signs of relapse, although this is less common. Overall, a biopsy is a minor surgical procedure that plays a key role in confirming a lymphoma diagnosis. It guides treatment decisions and helps to understand the extent and behavior of the disease. This procedure is performed under medical supervision with appropriate anesthesia and laboratory support to ensure both safety and accuracy in diagnosis. Always consult with a healthcare professional for personalized advice and information regarding biopsies and lymphoma.